On April 7th, 2025, the CMS, or the Centers for Medicare and Medicaid Services, announced that they would be increasing Medicare Advantage funding by an average of 5.06%, estimated to be an additional $25 billion in government funding to Medicare Advantage programs for 2026. This compares to an average of roughly in the ballpark of only about a 3% increase the previous 2 years. Now, there's multiple reasons why CMS increases the funding for Medicare Advantage plans, one of which is inflation, right? Inflation affects everything, and it's something we've seen a lot of the past 5 years. And so inflation affects the cost of medical care just like anything else. So hospitals charge more, doctors charge more, labs to charge more. Every type of medical provider ends up charging more, which means it costs insurance companies more to cover those items. Now, the reason why this matters is if you've been following this channel for some time, you would have seen specifically the previous 2 years, but more than anything, the last open enrollment period, the last annual election period that happened in the fall, that in many areas, lots of plans either terminated their coverage. There was a record margin of folks that had their plans terminated in open enrollment this past fall of 2 million people nationwide. And the people that didn't have their plans canceled in a lot of areas saw their benefits take a bit of a nosedive. This was because a multitude of different things, but partially because of record high inflation numbers and lower CMS reimbursements and increasing of funding. In addition to that, insurance companies, due to the Inflation Reduction Act, were forced to take on a lot more cost towards prescription drug costs than they ever had before. So you combine those things, they have to make up for their shrinking profit and margins somewhere, and what you saw was in benefits. With some plans, it was network reductions. Medicare Advantage plans are made up of a lot of different working parts. In some areas, it was network reductions, not as many providers or hospitals being contracted in the network for the new year. In some areas, it was benefit reductions, such as maybe slashed dental, vision, or hearing benefits. And in some areas, it was higher medical copays, higher hospital copays, higher maximum out-of-pocket limits. But in a lot of areas, not all, there are some exceptions, but in a lot of areas, we saw plans take a significant nosedive in terms of coverage. So what does this mean? Because in January of 2025, while the Biden administration was still in the White House, they proposed an only 2.23% increase in funding for Medicare Advantage plans. Now, with this ending up being almost 5.1% of increases, it's substantially higher than it's been for several years, and this additional $25 billion in funding is required to go back into the plans. Medicare Advantage plans are required to put 85% of the funding they receive back into the plan benefits and payment of claims. So what does this mean for Medicare Advantage benefit holders, okay? What we'll probably see this upcoming open enrollment period is benefits starting to take a bit of an increase, right? Any benefits you saw that were slashed, you might see them recover a little bit, maybe new benefits being added. You might also see new insurance companies go into areas they weren't before, new plans being made available. We've already been made aware, without naming any names, of a couple of insurance companies that will be expanding into states they've never been in 2026. So ultimately, what we believe that this means for anybody that has a Medicare Advantage plan is probably a good thing for your plans overall. Because if you noticed your plan not covering as well as it did in a multitude of different areas, that wasn't an accident going into 2025. A vast majority of plans saw that being the case. My name is Christian Brindle. I run a company called Everything Senior Insurance, also known as Christian Brindle Insurance Services, or formerly known as that. And we specialize in working with folks on Medicare health plans. We work with a multitude of different insurance companies. We're nationwide. We're licensed in 45 states. And we pay very close attention to this year in and year out. So for the people that don't like Medicare Advantage plans, we've always taken the stance that Medicare Advantage plans have their place. They have their pros and their cons. Medicare supplement plans have their place and have their pros and cons, but it does a lot depend on your area, what's available, what premiums look like, and what your specific needs and preferences are. There are, let's face it, millions upon millions of people in America that have Medicare Advantage plans. New studies show that almost 60% of Medicare beneficiaries have Medicare Advantage plans currently in 2025, while only about 25% of Medicare beneficiaries hold Medicare supplement insurance plans, and the remainder end up having group plans, veterans plans, TRICARE for Life, some other type of group or private retiree plan of some sort. And so the vast majority of people that are on Medicare Advantage plans. So if this is you watching this video, you might be able to expect some optimism going into 2026 and this fall's open enrollment period. I would expect to see a lot of insurance companies and a lot of plans raise their benefits due to this additional funding. We will keep you posted on this channel of what we see, but that's what we're expecting. You always got to follow the money, and more funding typically means more benefits. If you found this video helpful, insightful, and educational, do us a favor, smash the like button for the YouTube algorithm. It helps so many more people on Medicare just like you find this information who desperately need to hear it. Comment your thoughts down below. Do you think this is a good thing? Do you think it's a bad thing? Do you think it's good that these carriers and these insurance companies are getting more funding? Do you think it's a horrible thing? Do you think they should just all be shut down? We'd love to hear your thoughts about it either way. And make sure to subscribe for future Medicare information and advice on how to best get the most out of your Medicare. Thanks so much for watching, everybody. We'll see you on the next one, and happy Medicare.